Hello, my name is Dee Dee Nelson and I'm the Director of Nursing for Support Solutions. This is a medication refresher class that's to hopefully be able to get everybody on the same accord to give medications safely to our supported people. We'll have different presenters during the demonstrations to show you how the skills to properly give the medication, and also different people giving medications so that you can see how it can be correctly done in the homes. It is important, as we all know, to follow the 3 checks when giving our medications. You can see the 3 ways that we need to check our medicines prior to giving them to their supported people. It is also important to follow the rights before giving our medication, that it's to the right person, the right position, the right time, the right texture, the right route, the right dose, the right drug. And we know that our supported people also have the right to refuse, and we need to use right documentation when giving our medication.
My name is Vanessa Grant. I am a registered nurse. The objective for the training today is to demonstrate the skilled practice that should be used in the home daily to ensure that supported persons receive their meds the same as the doctor has ordered the meds to be administered. The second objective is to make sure that when you administer the meds, that you read 3 times before the medicine reaches the person to prevent errors from being made. The third objective is to demonstrate, after the person has received the medication, that you do a final read to make sure that the meds were administered as ordered by the PCP, and to make sure that you record to the MAR that the med was administered correctly. When you first start out, you need to gather equipment. The necessary equipment: you should have gloves, you should have medicine cups, drinking cup, hand sanitizer. Make sure they have water in their cup. Any tissue that you need to clean the eyes or ears with for the procedure, as well, a pen to record, and a medication record. You need a supported person to make sure that before you start the process that they wash their hands at the sink with soap and water to prevent the spread of disease or germs, as well as yourself should do the same. Go to the sink and wash before you start the process. The next step should be go to the closet or wherever in the home your MAR and your supply is located to bring to the table wherever you're going to administer the meds at. Okay? When you open your MAR book, you want to find the MAR and look in the hour column on the MAR for the time of day that you're in the home administering the meds to the supported person. You read the MAR. It is 8 a.m. And then you go to the supply and you remove the container from the supply. You do your first read by matching the label to the MAR. The person's name, check Stephanie Smith on the label. On the bottom of the MAR, the person's name to ensure it's the right person's MAR and it's the right person's medication. Read the script, Colace, 100 milligrams, 2 tablets by mouth every day, and match it. You're matching the label to the MAR. That's the first read. You're going to proceed to give other meds at the same time. You go look at the next med on the MAR, remove the container from the supply. Read Stephanie Smith, Dilantin oral suspension, 125 milligrams per 5 milliliters, 10 milliliters by mouth every day at 8 a.m. Seizures, Dr. Allen House is the reason. Go to the next med in the supply. After you read the MAR, artificial tears, 2 drops in both eyes every day at 8 a.m. Once you have set up all the meds that has to be administered, you look at the meds according to the route. Oral meds are always administered first, okay? So you start a process of eliminating what you're going to start out with first to complete your second and third read before you administer the medication. Okay, so I'm going to pick up the Colace first, and I'm going to do a second read. Colace, 100 milligrams, 2 tablets by mouth every day. And then I'm going to wash my hands before I proceed to remove the med from the container and apply my gloves. Then after I apply my gloves, I'm going to find the date of the month that I'm administering the medication, which is today is the 7th. And I'm going to take the medicine cup and place it underneath the dose of a medication that I'm going to remove from the container. So I remove 2 tablets into the cup. Then I proceed to do my third read. Colace, 100 milligrams. I have 2 tablets by mouth every day. Time is 8 a.m. When you're doing your 3 reads, remember you're being observant to the 7 rights. Do you have the right person? Is the person in the right position facing you, and you're facing the person as well in the right position. As I read, I observed the drug name, I observed the dose that I had to administer, and the time that the med had to be administered, and the route, the way the med had to be administered. Always remember, you're reading to be observant to the 7 rights to assure that there are no errors being made in the 7 rights. Okay. Now, I'm ready to administer the medication after I did my third read before it reached the supported person. As I give them the medicine, I observe for the swallow, and then I immediately remove my gloves and sanitize my hands. It is time now to record what I just administered. You read the MAR, which is the final read, come across from the time and the date that the med was administered, and write your initials on the MAR to record it immediately after the med was administered, then return the container to the supply. My next medication will be the Dilantin oral suspension. I'm going to read my second read. Dilantin oral suspension, 125 milligrams per 5 milliliters, 10 milliliters by mouth every day at 8 a.m. seizures. Okay. So I need to shake this. It is a suspension. Some liquid meds you have to shake before you administer. When you remove your top, the tops are not clean. You never know where they've been last. So I take my top off. Remember, the top you want it to always place it against the tabletop, okay? Without touching the inside, okay? Pick up my cup, find my measurement on the cup. My dose is 10 milliliters. When you pour liquid meds, make sure the label is in the palm of your hand. Always hold the cup eye level. To get the accurate measurement, never look down in the cup. Protect the label by placing it in the palm of your hands. Okay, now I'm going to return my top, and I will wash and put my gloves on. I'll do my third read after the med is in the cup. Dilantin oral suspension, 125 milligrams, 5 milliliters. My dose is 10 milliliters by mouth every day, 8 a.m. She's in the right position. She is the right person. And I observe her swallow her medication. Remove my gloves, wash my hands. Final read, Dilantin oral suspension. I gave 10 milliliters. The route was by mouth, and the time I gave it was 8 a.m. I come across from the time on the MAR underneath the date that I administered the meds, and I sign the MAR. And I return the container to the supply. The last med to administer is the artificial tears. I proceed with my second read, artificial tears, 2 drops in both eyes every day at 8 a.m. Because I'm not placing it in the cup this time, I'm gonna go ahead and do my third read. Artificial tears, 2 drops in both eyes every day at 8 a.m. Remove the container from the box. Take my top off. Lay my top to the side on the table. Proceed to wash my hands and apply my gloves. I'm going to clean the eyes first. The position for the head should be looking up, never look down. I'm cleaning the eyes so the eyes are closed. You're going to wipe from the inside out. Change your end of your washcloth and clean the other eye to prevent spread germs from one eye to the other eye. Ask the person to look up. Your thumb on the bottom, your forefinger on the top. Never give the eye drops in the person's field of vision. When they see your hands, they'll blink. So you want to get on the outside field of vision to the outer edge and drop and let them blink, drop and let them blink, okay? I'm gonna turn the doll to the other side so my thumb will fall on the bottom and forefinger on the top and hold the head back looking up and drop, let them blink, drop, blink. Any excess, clean the eyes. Now I want to remove my gloves and sanitize according to the guidelines. When we use gloves, always wash before and after using your gloves. I'm going to replace my top now since I'm clean. Put my dropper back in the box, my container back in the box, and I'm going to do my final read. And I'm going to find the time, artificial tears, to make sure I record correctly and that I gave the med the same as the doctor ordered the med to be administered, and place my initials on the MAR. Once I did my documentation, I'm returning the container to the supply. Now I must verify that my charting is done completely or correct by making sure on the back of the MAR I have my initials, my signature, and my title written legibly so that others can read it. That concludes the demonstration for eye and oral. This demonstration will include the administrations of the route for nasal, ear, inhalation, and patch topical use. Again, gather all necessary equipment. You will need tissue, hand sanitizer, and gloves for this procedure, and a pen to record the meds onto the MAR after you administer the medication. Remember, always wash your hands at the sink with soap and water, the supported person and yourself first before you start the procedure. Go to the closet or the location where the MAR book is at and the supply. Bring it to the designated area in the home that you will administer the meds. Open your MAR book. There should be a photograph on the front of the MAR book to identify your person to make sure that you're administering meds to the correct person. Open the MAR book. Look at your MAR. Look in the hour column on the MAR for the time of day that you're in the home administering the medication. Go to the supply, unlock it, and proceed to remove your containers from the supply. The first one, I'm going to administer eardrops. When I read the MAR, I will match the label with the MAR. Cortisporin. Her name is Stephanie Smith. Identify the name on the MAR and the label. Stephanie Smith, Cortisporin, 2 drops right ear every day at 9 p.m. First read. The next med, nicotine patch. Go to the supply, remove the container, match it to the MAR. Stephanie Smith, nicotine patch. Apply 1 patch every day at 9 p.m. Tobacco use. Next med, moisturizing nasal spray. I match it to the MAR, first read. 2 sprays each nostril at 9 p.m. Stephanie Smith, nasal congestion. Last medication, Pulmicort inhaler. Stephanie Smith, 200 micrograms, 1 inhalation every day at 9 p.m. Dr. House Asthma. Now, as I look at all the meds that have to be administered at 9 p.m., I start the elimination process, which one would I administer first and which one I will administer last. All of these routes do not require food or water to administer, okay? So I will start with my eardrops first. Then I will proceed to my nasal spray, then my inhalation, and then my patch last, okay? So as I pick up my eardrops, I proceed to do my second read, cortisporin, 2 drops, right ear every day at 9 p.m. And because I'm not going to place the medicine in a medicine cup for like oral, I will go ahead and do my third read, cortisporin, 2 drops, right ear every day at 9 p.m. I will remove my container from the box, set it to the side. The tops are considered not clean, so I take my top off first before I wash with the sanitizer and apply my gloves. My supported person, put them in position. We want the right ear. So this would be her right ear. Good. This is the left one. Make sure I got the right ear, that's right. And I want to position the head to the side, horizontal. And you always want to pull for the adult ear, the ear up and back. Hold the ear up, take the drops and administer the drops. 1 drop, 2 drops. Put the container down and close the earlobe. For 1 ear, you will keep the head over 3 minutes. After 3 minutes up, I need to remove my gloves, wash my hands, and return my top. Now I'm ready to record. Put the container back in the box. Do my final read. Stephanie Smith, cortisporin, 2 drops, right ear every day at 9 p.m. Come across for my time on the MAR underneath the correct date and initial. Return the container to the supply. My next medication would be the nasal spray. I proceed to do my second read. Moisturizing nasal spray, Stephanie Smith, 2 sprays each nostril at 9 p.m. Nasal congestion. Remove my top, lay my top to the side without contaminating it. Wash, put my gloves on. Close the nostril. Place the container at the tip of the nostril or nasal without touching the skin and spray and to inhale the it into the nasal passage, sniff. Close the other nostril. I got 2 sprays. I do another spray, same nostril, spray, sniff. Close the other nostril. Spray, sniff, spray, sniff. Lay it down, the container down, remove my gloves, sanitize my hands. Now I can return the top without spreading body fluids. And I go ahead and do my final read. Moisturizing nasal spray, 2 sprays each nostril at 9 p.m. Come across from the time on the MAR up under the correct date. Initial the MAR. Return the container to the supply. I'm ready to give my inhaler next. And I must do my second read. Pulmicort inhaler, Stephanie Smith. I'm giving 200 micrograms, 1 inhalation every day at 9 p.m. asthma. Go ahead and proceed to do my third read. Pulmicort inhaler, 200 micrograms, 1 inhalation every day at 9 p.m. Before I remove the top, because this already been in the mouth, I want to go ahead and wash my hands and apply my gloves and then remove my top. Make sure this is shaken prior to administering. It's an aerosol. And I want to place it inside the mouth and tell her to seal her lips around the mouthpiece tightly. On the count of 3, when I spray, I want you to inhale and hold. Hold for 10 seconds and then exhale through the nose slowly. I will demonstrate it. 1, 2, 3, spray. Clean the mouthpiece prior to returning the top while you got your gloves on. Okay. Always inspect the inside of the mouth for sores, as people can develop yeast infection from using inhalers. Keep these stored clean in the supply so people do not develop lung infection or any type of infection in the lungs. You can give them a little cup of water to rinse their mouth out after using the inhaler to prevent yeast buildup inside the mouth. Now, I need to do my final read. Pulmicort inhaler, 200 micrograms, 1 inhalation every day at 9. And I need to come across from the time underneath the correct date and initial the MAR that I observed them receive the medication. Return the container to the supply. My last med is the patch. Proceed with my second read. Stephanie Smith, nicotine patch. Apply 1 patch every day at 9 p.m. My third read, since it's not going into the cup, is topical. Nicotine patch. Apply 1 patch every day at 9 p.m. Tobacco use. Remove my patch. Remember, always look for the patch where it was applied last before touching the doll. You want to make sure with the patch, you wash your hands. Remove the outer covering to the patch. Put the time on the patch that you're administering the meds and the date, month, date, and year. Apply the gloves. Remove the patch that was there previously. Rotate the site. Never put the patch in the same area because it irritates the skin. When you look on the back of your MAR, you have sites where you rotate the patch, and you use codes to document on the MAR where you applied the patch. So I'm going to clean the skin before I apply the patch. And I'm going to let it dry, and I'm going to apply the patch. Remove my gloves, wash my hands, do my final read. Nicotine patch. Apply 1 patch every day at 9 p.m. Find my time and come across from 9 p.m. Find the date and initial the MAR. Underneath my initials, I'm going to put the code for where I applied the patch. Right on. Code is RA. Come across from site underneath my initials and write RA for the site I applied the patch. Turn on the back to finalize my charting to make sure it's all correct and complete. Verify my initial, my signature, and my title 1 time for the whole month. Now I return the container to the supply. Secure the supply, return it to the location where I removed it from with the MAR. This demonstration will include rectal, vaginal, and topical use for skin. Again, gather all your necessary equipment that you need: gloves, hand sanitizer. You will need a sanitary napkin for vaginal use, a brief to put up on your supported person for rectal use, a pen to record your meds immediately after you administer the medication, Remember, always wash your hands to prevent the spread of disease and germs, as well as the supported person. Go to the location where the MAR and the supply is located. Remove, bring to the designated area in the home you're going to administer the meds. To provide privacy, we always want to administer rectal and vaginal in a room to provide privacy before administering the meds. Again, open your MAR book. Identify your patient to make sure it's the right person. Then remove your MAR and read. Look in the hour column for the time of day that you're in the home to administer the medication. Okay? And proceed to remove your containers from the supply. I will be administering to Stephanie Smith a saline enema, Fleet, 1 bottle rectally every 3 days at 8 p.m. First read. She will also receive a Monistat vaginal suppository. Insert 1 suppository vaginally at 8 p.m. Yeast infection. Topical use. Stephanie will receive hydrocortisone cream applied to rash on left wrist every day at 8 p.m. As I look at what I'm administering, I'll start the process of elimination. And I will administer the cream first. So I will proceed with my second read. Hydrocortisone cream applied to rash on left wrist at 8 p.m. Dermatitis. Third read, hydrocortisone cream applied to rash on left wrist every day at 8 p.m. Dermatitis. I'm going to remove my container from the box. Verify it's the right med in the box. And I'm going to flip my top. Proceed to wash my hands. Because my right hand is my dominant hand, it will be my dirty hand because that's my working hand. My left hand is my clean hand. So I always want to make sure whenever I pick the tube up, I pick it up with the clean hand. Never take my hands and cross. Never take clean and touch with dirty. You want to keep them separated during the procedure to demonstrate clean technique, okay? So I got my gloves on and get my patient. And she's laying in the bed, and we want her left wrist. Okay. She just has a rash on the left wrist. So you observe the location where you're going to apply the med. Before applying it, always make sure it's clean, skin look clean. And I'm going to go ahead and take the tube with my clean hand. Pick it up. You can apply the cream to the skin and rub it in, or you can apply it to a clean glove and rub it into the skin. When you apply the medicine, always from the center of the location of the area and rub in a circular motion out, away from the site. Never go back to the beginning in the center because you're going from clean back. You're going from dirty to clean. Okay, so in a circular motion, out, away. Okay, not a lot, just a small amount, enough to get it absorbed into the skin. When I get through, I'm gonna set my tube down and I'm gonna take my gloves off and wash my hands. Flip the top, return it to the box. Final read, hydrocortisone cream applied to rash on left wrist every day at 9 p.m. Find my time, come across on the correct date, initial. Return container to supply. Okay. While we're in the room, I'm going to go ahead and administer vaginal. So her name is Stephanie Smith. Check the label. And it's Monistat vaginal suppository. Insert 1 suppository vaginally at 8 p.m. Second read, Stephanie Smith, Monistat vaginal suppository. Insert 1 suppository vaginally at 8 p.m. take my suppository from the box. Make sure I place my applicator on a clean surface. I got my sanitary pad. I need to prep the medication. Remove all your outer coverings, put it into the applicator. But before I do it, I'm gonna check it again because I had to prep this dose of medicine myself to make sure I prepped it correctly according to the orders. Monistat, vaginal suppository, insert 1 suppository vaginally at 8 p.m. Take your hand and your thumb and your forefinger. Spread the labial lips apart. Tell the person to take a deep breath and insert the applicator into the vaginal tract as far as it'll go and push the plunger on the applicator in to release the medicine inside the vaginal area. Remove the applicator and dispose of it. Remember, while you have your gloves on, place your sanitary pad. Always instruct the supported person to stay down at least 10 to 30 minutes after administering vaginal medicine so it doesn't drain out the person's body. Remove your gloves, wash your hands. Final read. Monistat vaginal suppository, insert 1 vaginally at 8 p.m. Go to the 7th, cross from your time, initial the MAR, return the container to the supply. Okay, while she's in the room, we're gonna go ahead and administer the enema. And I do my second read, saline enema, Fleet, 1 bottle rectally every 3 days at 8 p.m. I'm gonna go ahead and do my third read, Stephanie Smith, saline enema, 1 bottle rectally every 3 days at 8 p.m. And I can go ahead and take my top off. I'm gonna leave it on because I want the water getting off. But I'm gonna proceed to wash and put my gloves on. The position should be on the left side with the person's back facing you. I'm gonna take my thumb and pull the upper cheek up to administer this medication so I can see the rectal opening. Tell her to take a deep breath. As I insert, I go in a slant toward the back wall. I take my thumb that's holding the upper skin of the buttock and press down to try to seal it because she's going to have an urge to push. So to try to get rid of some of that urge to push, as I'm squeezing, I'm telling her to hold. Don't push. Don't push. Okay? Don't push. If you see any draining out, that means she's pushing, so you're going to have to intervene and support the hole. Come out and push down. Don't leave it open because you push what you already administered out. Hold it for at least 10 minutes until you think the urge for the push has passed. Once the urge to push has passed, you can go ahead and close them up in the brief and let them know it'll be 2 to 5 minutes before you have an urge to push what's in out. So try to hold it as much as you can, but in 2 to 5 minutes, you're going to have an urge to push what's in out, okay? And I'm going to go ahead, since my label is on my container, I'm going to final read while I got my gloves on. Stephanie Smith saline enema, 1 bottle rectally every 3 days at 8 p.m. Dispose of the bottle because it's one use. Then I'm going to take my gloves off, wash my hands, and I'm going to read the MAR, find the time I gave the med and the medication drug name, and initial the MAR. Always check to make sure your charting is complete or done correctly at the end by assuring that your initial, your signature, and your titles on the back of the MAR one time for the entire month. That concludes my demonstration of all the routes for administering medications according to the skills safely to the supported persons in the home to make sure that we're not making errors. Always read before you administer medication. Thank you.
This next section is we're going to have a demonstration with a supported person and the DSP to be giving the medications to our supported people. I want you to watch the video to see what times you think if the meds are given correctly or if the meds are given incorrectly. And look to see what you think could be done better.
JD, my man, it's time for you to take that afternoon med. You ready? All right, great. I already know that this yours because your name right there, but I know you're supposed to take these pills anyway. Here you go. There you go, JD. Okay, JD, thanks for taking your med.
Peter, we're going to take our meds so we can head out into the community. Ready?
Leave me alone.
Peter, everything I do is for your benefit, okay? I want you to have your meds so we can continue to go out in the community and do fun stuff. Cool?
I tell you, leave me alone.
You want to take your meds so we can leave the
You
house?
gonna leave me alone? I take my med.
I absolutely will leave you alone. Okay. Some water.
Want no water? Leave me alone.
Okay, Peter. I'll just document and we'll just try another time, okay? So you're refusing to take your 4 o'clock med? Okay. You know, if you don't want to take your meds, you could have just said so earlier. You didn't have to wait until 4 o'clock. You know? Just think about what you're doing.
Hey, Peter.
Hi.
It's time for you to take your meds. Have you washed your hands at the sink with soap and water?
No, ma'am, I haven't.
Okay, you want to go wash your hands right quick?
No.
Well, let's use a little sanitizer then. Sanitize your hands.
No, I can use that.
Okay. All right, got your MAR. I'm gonna look at your MAR and see what medication you're gonna get at 4 o'clock. And you got blood pressure medication you gotta have. Okay. So, low pressure.
Do I gotta take that medicine? I don't like that.
Well, you know, it's for your blood pressure, to stabilize your blood pressure so you don't have those headaches and lightheaded and dizzy.
Yes,
Okay?
yes,
And it makes you not have those headaches all the time like you've been having. Okay? It should help
yes,
stop the headaches. Okay? All right. So I got low pressure, 50 milligrams, 2 tablets by mouth every day, 4 p.m. And check it again. Low pressure, 50 milligrams, 2 tablets by mouth every day at 4 p.m. Watch me put my gloves on and get me a medicine cup. And I'm looking for today's date. Punch. 2 tablets. Check it again. Low pressure, 50 milligrams, 2 tablets by mouth every day. Blood pressure, Peter Wright. Okay, Peter Wright. All righty. I'm gonna sit up straight. Drink some water. All right, good. How you feeling?
I'm just gonna talk to them now.
Okay. Did you swallow it?
No.
No mouth. Okay. Well, let's see. You swallow it. Okay. Take my gloves off. Wash your hands. All right. Low pressure, 50 milligrams, 2 tablets by mouth every day. 4 p.m. Wait. Okay. Mission. Signature title. Time. Title to the side.
Now, can we go to the Skinner Center?
Sure, let's get ready to go.
All right.
Okay.
This next section is about the medication policy for Georgia. Please read along, as you can see on the screen, of the medication policy. There will be a quiz at the end for you to review. The medications in Georgia, we observe and assist the supported people as needed for their medications. It is important to understand that there is a time frame for assisting with the scheduled medicines. There is 30 minutes prior and 30 minutes after the scheduled medication. Only a physician's order can extend the medication time for supported people. The medication orders include the prescriptions and any over-the-counter medicines that need to be ordered by the treating physician, which could be a dentist, a doctor, physician's assistant, or a nurse practitioner. Even over-the-counter medicines, such as Tylenol, will need an order. A vitamin or an herbal supplement must also have a physician's order. No medicines will be administered or prescribed for punishment or convenience of the supported staff. Only licensed staff members, such as a licensed practical nurse or registered nurse, are allowed to take verbal or telephone orders. If you go to the physician's office and he says, well, just give one pill when he needs it, and doesn't write it, then that is not acceptable. We must have a written order. The doctor's office can send an e-script to the pharmacy, call the medicine in, give your prescription pad, or make the note on the medical consult. The direct support staff receiving medication orders while on medical appointments are required to inform their home manager of the new order immediately and no later than 2 hours after the appointment. The home manager or the designee will fax the copy of the order to the pharmacy and the nurse manager, nurse, or designee immediately to ensure that the medicine is in the house within 24 hours. The home manager or designee will pick up the medicine and ensure that proper documentation of the new order is on the medication record and removal of any discontinued medications. The pharmacy and the treating practitioner are available to answer questions. The nurse is also available to the DSP 24 hours a day, 7 days a week. The home manager is responsible for reviewing the medication record daily for errors when in the home and ensuring that the physician's orders are present for all the medications. The pharmacy provides a medication label which gives instructions for the rights of the medication administration. Only physicians and pharmacists can dispense medication. Medication refills. It is important that the supported person has a continuity of care without a break in the medications that are ordered for routine daily use. Refills are to be received within 24 hours of the medication prior to the medication running out. It is important that the supported person never runs out of the medication. This is a medication error, and we know that it can affect the care of our supported person if they do not have the proper medications. If the supported person has an emergent need for medication refill, he or she can be taken to the emergency room. It is important that before the medication runs out, that the doctor's office is contacted to provide the refills that are needed. Documentation needs to be provided for the attempts to get the medication filled prior to waiting for it to run out. There are times that the insurance company may want a prior approval. We just need to keep a paper trail of all those times that we contact the doctor's office trying to get that prior approval so that the medication can be in the home in a timely manner. Prescriptions and over-the-counter medicines must be labeled appropriately and stored in a locked container or an area that is designated strictly for medication storage, supplies, and records relevant to the medication management. We know that medications need to be under lock and key at all times for monitoring and to prevent unauthorized access or usage. Regular medications need to have one lock. If it is a controlled medication, it must be under 2 locks. These locks can be in a medication cabinet that is locked, and then inside the cabinet are the medication pills in a tackle box, whatever kind of medication box, so that is our 2 locks. The home manager and direct support staff should ensure that all external and internal medicines are stored separately in a different container or in different Ziploc bags. All scheduled 2 to 7 medications, such as narcotics, barbiturates, and controlled substances, must be double locked. An example is a locked box in a locked cabinet or closet. Medication requiring refrigeration must be stored in a locked container in the refrigerator. This can be in the home refrigerator if placed in a properly locked container and kept separate from food items. Direct support staff are required to keep a daily temperature log for all locked and refrigerated medications. The MAR is the medication administration record. It's to be kept in the travel or the daily book, along in the record with the practitioner's orders. The next section is documentation. It is important that all medication orders must be noted on the MAR and contain the following information: the name of the drug, the dose and the strength, the route of the administration, like oral, rectal, optic, the time that the medication is to be administered. If the medication is ordered for a set number of days, the start and stop date need to be noted. Any special considerations for the administration must be listed on the MAR, such as when there are parameters for medication that are ordered that are to be listed, such as an example is to hold digitalis for a heart rate less than 60 beats a minute, or an example is to give the medication with meals. Blank spaces are not acceptable. Draw a line through blocks showing the days the medication is not administered, such as a drug that is administered every other day. Draw a line when the medication is discontinued. There are acceptable abbreviations, and they are as follows: H for hospital, R for refused, NPO is nothing by mouth, HM is home visit, DS is day service. Some medications have different doses at different times. A separate entry on the MAR is made for each prescribed dose. 2 separate blocks on the MAR are to be used, such as if you have Depakote 500 milligrams in the morning and Depakote and you only give 100 milligrams in the evening. That needs to, even though it's the same medication, you need to have it on 2 different blocks. Staff are to sign the MAR with their initials and to identify their initials with their full signature and title on the back of the MAR. A signature ledger can be utilized to document each staff's signature, initials, and title to assist with clarity as needed. We know that some staff members have penmanship that you can't read. And it is important for when surveyors come that they can read legibly. The next section is the documentation of controlled substances. You can see that we provided examples of control count sheets. There are 2 different sheets that can be used. Here is one that shows for the whole week. Here is another sheet that shows an ongoing sheet. It seems whichever house manager wants to use the sheet, the preferable sheet is the one that goes from Monday that has 7 to 3, 3 to 11, and 11 to 7. Your house manager can decide if there are issues and you have trouble. We do have some other sheets that are available for the homes that have difficulty keeping up with the control count sheets. All scheduled 2 to 7 are marked accordingly from the pharmacy so staff know when a control count sheet needs to be used. If you go to a local pharmacy and don't use our regular pharmacy, at times you may not get the count sheet and the control sheet. You should have spare one of these sheets in the home, or you can contact your nurse to get some sheets. The count sheet must be done in the presence of 2 staff, preferably 1 staff from the off-going and 1 staff from the ongoing who are properly trained with meds. The count is verified to make sure that the correct doses are present. Discrepancies in the drug count are to be reported to the supervisor, agency, administrator, nurse, or designee for further instructions. No staff, under any circumstances, is to leave the premises until the discrepancy is resolved by management with the proper actions. Controlled medicines are controlled and they are reportable to the state if they are not done properly and if there's a miscount of the meds. The next section is medication side effects. You should have the availability of side effect sheets for each of your medications. If not, you need to contact the pharmacy or your nurse to get those in the home. These sheets need to be read so that you can understand if there's any problems. There should be a place on your MAR that says that you have looked to observe for any side effects of your supported person and to document accordingly. The next section is medication disposal. Medications must be destroyed when it is contaminated, such as dropping it on the floor, refused, discontinued, expired, or the label is not legible. Staff person is to dispose of it, and you must have 2 staff present to witness the disposal. Another avenue is to bring the medications to be disposed of to the office for the nurse to properly dispose of. The office is to have a record of the medication disposal record so that we can keep up with how many medicines are here and when they are disposed of. The next section is the medication refusal. Supported people have the right to refuse. Direct support staff are required to offer medications 3 times within the designated time frame. Direct staff are to inform the supported person of the consequences and the risk when not taking the scheduled medicines. An example would be you need to tell the supported person if they do not take their seizure medicine, then they are at risk for having a seizure. At no time is the missed dose to be made up before the next scheduled dose. The nurse or designee will contact the treating practitioner regarding medication refusal if it becomes to be a habitual thing. The home manager or direct support staff should notify the nurse or designee if the supported person refuses medications after 2 consecutive med passes. An example of this is if they refuse their 8 p.m. meds and then the next day they refuse their 8 a.m. meds. The nurse needs to be notified because at that time we probably need to contact the treating physician. The next section is medication reactions. The Support Solutions nurse or designee will review the records of the supported person for any allergies. The chart and the MAR are to be properly identified for any allergies that the supported person would have. It is important to call 911 at any point if there is any life-threatening symptoms. A block on the MAR needs to be identified of Y means yes if you see side effects and N means no, that there are no side effects. If this is not indicated on your MAR, you need to be sure to write it in and contact the nurse so that she can let the pharmacy know that needs to be added to the MAR. The next section is the handling of illegal illicit drugs, licit and illicit. Once it is made known that illegal illicit drugs are found in the possession of the supported person or the staff person, the staff discovering the incident shall immediately call the police. We follow the proper procedure for the critical incident form to be filled out and the proper notifications to also be made. The next section is PRN medications. All PRN medicines must have a treating physician's order. The order must be clearly written with parameters to define the circumstances when the medication must be administered, such as the specific symptom, the dose, and the route. An example would be to give Tylenol. It needs to say PRN for pain or PRN for a temperature greater than 100.5. PRN medications are to be stored separately from the regular scheduled meds, such as in a Ziploc bag or a different locked container. The next section is on medication error reporting. It is important that when you see a medication error or problem, that is properly recorded and sent into the nursing office within 24 hours. If you find it, it doesn't mean that you made the error. It's important for us to all be on board and to pinpoint when medication errors happen. Documentation errors happen, like if there's a failure and you forget to initial the block on the MAR. If the medication is found in the inappropriate place, such as the person's clothing, mixed with other meds, or in a package that is not legible, this is considered a medication error, and we need to document that. The next section is on properly security and storage of the medications during absences. You can read this if your person goes home and how to properly store it and move it. We do have a leave of absence form so that we can properly document how many medicines go with the supported person when they leave the home. Supervision of the self-administration. You can read the sections to know. Emergency procedures. This is a section that says in case of a life-threatening, you contact 911. And then when it is safe, you can contact the nurse and the proper administration. This concludes the section on the medication policy. Thank you. Here at Support Solutions, the nursing department appreciates all your time and effort that you spent today on this training video. If you have any questions, you are welcome to call your nurse at your office at any time. A nurse is available for you 24 hours a day, 7 days a week, weekend and holidays included. If you have any trouble reaching your nurse, you can always reach me Dee Dee Nelson as the Director of Nursing. My cell phone number is 901-496-0497. And I appreciate all your time and effort. For some offices, there is a quiz after watching the training video for you to complete. Thank you.